Welcome to VisionCenter's podcast, where we dive into the captivating world of eye care and vision health. I'm your host, Alex, alongside my co-host, Jordan. Each episode, we explore the fascinating realm of vision, bringing you expert insights, the latest advancements in the field, and actionable advice to take care of your sight. So sit back, relax, and let's open our eyes to the world of vision. Welcome to VisionCenter's podcast. Today we have Jordan, an expert in eye care, joining us to talk about a very important topic, keratitis. Jordan, thank you for joining us.
Thanks for having me, Alex. Glad to be here.
Let's dive right in. What exactly is keratitis?
Keratitis is the inflammation of the cornea, which is the clear outer layer of the eye that focuses light. It can vary in severity and may affect one or both eyes.
Is keratitis something that can be contagious?
Some forms of keratitis can be infectious, but they're not often transmitted to others. For example, keratitis caused by herpes simplex and herpes zoster viruses is somewhat contagious through skin contact, but rarely spreads by eye contact. Non-infectious keratitis, like those due to eye injuries, isn't contagious unless an infection develops.
Interesting. Could you tell us about the different types of keratitis?
Sure. Keratitis is mainly divided into two categories: infectious and non-infectious. Infectious keratitis can be caused by bacteria, fungi, viruses, or parasites. Non-infectious keratitis could result from physical trauma, a weakened immune system, or exposure to extreme environmental elements like sunlight.
Let's break those down a bit. What causes bacterial keratitis?
Bacterial keratitis mainly occurs due to improper and unhygienic use of contact lenses. The two primary bacteria responsible are Pseudomonas aeruginosa and Staphylococcus aureus.
And how about fungal keratitis?
Fungal keratitis is usually the result of eye trauma or contact lens use, often prevalent in tropical and subtropical regions. The fungi involved often include Candida species, Fusarium, and Aspergillus.
Viral keratitis seems a bit different, right?
Correct. Viral keratitis can be triggered by stress, weakened immunity, or exposure to direct sunlight. It can be chronic and frequent, commonly linked to the herpes simplex virus, varicella zoster virus, and adenovirus.
What's the story with parasitic keratitis?
Parasitic keratitis, or acanthamoeba keratitis, is caused by a microscopic parasite found in water, soil, and air. It often affects contact lens wearers, but can also result from corneal trauma or exposure to contaminated water.
And non-infectious keratitis, what causes that?
Non-infectious keratitis may result from eye injuries, weakened immunity, extended wear contact lenses, allergens, or environmental factors like extreme sunlight.
What are the symptoms someone might experience with keratitis?
Common symptoms include eye irritation and pain, red eyes, excessive tearing, eye discharge, sensitivity to light, blurred vision, and difficulty opening the eyes.
How is keratitis diagnosed?
An eye doctor will discuss your history and symptoms. During the exam, they might use a slit lamp to magnify eye structures and a pen light to check pupil reactions. Sometimes lab tests are needed to pinpoint the cause.
Can keratitis heal on its own?
It depends. Non-infectious keratitis might heal on its own, especially if caused by an eye injury. However, infectious keratitis usually requires medication to resolve.
Speaking of treatment, what options are available for keratitis?
Treatment varies based on the cause. It can involve topical antibiotics for bacterial infections, antifungals for fungal keratitis, antivirals for viral causes, and specific medications for parasitic keratitis.
What happens if keratitis is left untreated?
If untreated, keratitis can progress rapidly, leading to severe eye damage or even vision loss.
That sounds serious. What's the overall prognosis for someone with keratitis?
If treated early, recovery is usually quick. Delayed treatment can lead to complications like corneal scars, long-term inflammation, ulcers, recurring infections, and in rare cases, glaucoma or vision loss.
Wrapping things up, what tips would you give to prevent keratitis?
Always follow your contact lens care regimen, wash your hands before handling lenses, replace lenses as instructed, avoid swimming with lenses, use daily wear contacts, and contact your eye doctor if you notice any symptoms like redness or blurry vision.
Thanks for those insights, Jordan. Really helpful information.
My pleasure, Alex. Always happy to share knowledge about eye health.
That's all for today's episode on VisionCenter's podcast. Thanks for tuning in. And that wraps up another enlightening episode of VisionCenter's podcast. We hope you've enjoyed our discussion and found some valuable takeaways to help maintain your vision health.